A lot of times as we get older or after we have a stroke, we become afraid of taking steps because we're afraid we're going to fall back. But the worst thing you can do is not practice that. So I would recommend you doing something called moonwalks, which is basically just walking backwards. Not like Michael Jackson, he had a whole technique. You can work up to that if that's your goal, but ideally you want to use a counter, you can use your walker, take steps backwards. So doing the moonwalk helps with hip extension, which is needed when you need to open a door, when you need to move out of the way. If you lose your balance for some reason going backwards, you should be able to take a big, large step. But when we don't practice that, we end up just going straight back or taking multiple steps and end up falling. So like anything else, if you don't use it, you lose it. So make sure you practice this. If you don't feel safe, do it with a family member holding on to you or with the device like a walker. Walking backwards also helps turn on these muscles here, because a lot of times as we get older or we get weaker, we compensate using our walker by walking in this manner, and we just get tighter, weaker, and then there's a higher risk of falling because all our weight is coming forward. Taking steps backwards also helps us work on strengthening or control of these muscles, the pretibials, which help us or usually turn on when we take a step forward. Our toes usually come up after a stroke. Sometimes that can be affected, so going backwards can help stimulate that or promote that. If you feel like you still have foot drop or it's present, make sure to use your brace, or there's another technique where we can wrap your ankle, and I'm going to show you how to do that in another video. Bye.